Malia Freeman, and Malia did her practicum at the Flathead City County Health Department with Jim Wardensky as her site mentor. And the name of her presentation is Assessing Risk and Implementing Interventions to Prevent Foodborne Illness in Flathead County. So Malia, take it away.
All right. Can everyone hear me okay?
Yeah.
Okay. Perfect. So I'm just going to share my screen. Okay, so hi everyone. Thanks for joining today. So like Lee said, my practicum project is called Assessing Risk and Implementing Interventions to Prevent Foodborne Illness in Flathead County. So just as some background information, I completed my project with the Flathead City County Health Department, which is located in Kalispell, Montana, and it serves the surrounding area of Flathead County, which is about 108,000 people. So back in 2013, the health department enrolled in something that's called the FDA Voluntary National Retail Food Regulatory Program Standards, which is a mouthful. But essentially what the program standards do is they help to improve the regulation of food service and retail food establishments. And they do that by focusing on factors that contribute to foodborne illness. So the goal kind of overall is to reduce the occurrence of foodborne risk factors within our county. And so for my practicum, I helped the health department with standard 9 of the program, which is kind of made up of 2 parts. So the first is a risk factor study, and then the second is a targeted intervention plan. Oh, okay. So for the risk factor study, the Flathead City County Health Department gathered information from 687 routine inspections, and those occurred from October 1st of 2021 to September 30th of 2022. And the study really looked at the occurrence of risk factors that were separated into like 13 main categories, but they covered these general areas, which was food from unsafe sources, poor personal hygiene, inadequate cooking, improper holding time and temperature, and then contaminated equipment or protection from contamination. And so the data that we got from that 687 routine inspections was then analyzed so that we could determine the most common violation types that were occurring specifically in Flathead County. And those are featured here on this slide. But the 5 most common violations that were found in this report were improper cold holding, not meeting manager education requirements, improper reheating, sanitizer buckets not at proper concentration, and then refrigerated, ready-to-eat foods not properly marked and disposed of after 7 days. So we'll talk a little bit more about a few of those. So once we kind of gathered that data and analyzed it and put it into that report, we really focused on creating a mitigation plan. So we identified those common violations, and then we transitioned kind of our actions into creating this targeted intervention plan to help mitigate risk in areas that we selected out of our data. So we chose the 3 priority intervention areas that are on the slide. So cold holding, reheating, and sanitizer buckets. And I'll talk about each of those areas in more detail once we get into kind of our actions. But we selected these areas kind of for several reasons. First is that these areas, or the lack of, or like violations in these areas, can have some serious potential risk for foodborne illness. So we're trying to protect the public by choosing these areas. And then also our data really showed that these were 3 of the top 5 areas. And we couldn't do all 5 because that was kind of, like out of our feasibility. So once the priority areas were selected, we elicited feedback from the rest of the environmental health staff. So we did that by administering a fill-in form to all of the staff and asked them to give us ideas about different intervention strategies that we could use for each priority area. And then I took all of those ideas together and compiled them into kind of what you're seeing on this slide. And then I broke those into the different kinds of interventions that we could choose from. And then from there, I worked really specifically with the food team within environmental health to pick one intervention strategy for each priority area. And these intervention strategies were picked kind of on two general things. The first being feasibility. So what the workload would look like for public health staff and also for restaurant staff if we were to implement them. And then also based on impact. So how big of a difference we'd be able to make if we actually implemented each intervention. So priority area 1 is cold holding, and that basically is just making sure that refrigeration units are keeping food at or below required temperatures. And so for this priority, we opted to do a change to the current inspection process, which would allow for restaurants or food establishments to gain an incentive point if they use cold holding logs. So in Flathead County, when our sanitarians do an inspection, they give the facility a grade based on a letter-based grading scale from A to F. And those grades are given based on the number of violations, and those violations give you point deductions. So really what cold holding logs would do is that if the facility could show proof of consistent cold holding logs, they could be given a bonus point, which could help to negate one of their more minor violations. So this is really kind of a new systems change that they've never looked at doing before to see if that can help incentivize the idea of using cold holding logs, which is a good practice within food establishments. So priority area 2 is reheating. And that's just making sure that foods that were previously cooked are reheated to 165 degrees within a 2-hour window prior to serving those foods again. And so for this intervention strategy, we really wanted to do an educational campaign, and we wanted to focus specifically on restaurant staff who would actually be doing the reheating process. And we decided to do a magnet for this, and we picked that because magnets can be used on these magnetic surfaces that are actually in the kitchens of the food establishments. So something that I learned from the sanitarians is that there are a lot of things like steamer tables within restaurants. And so we thought that if we could put the educational reminder directly where the action was taking place, it may actually incite positive behaviors to happen. So people may actually remember to reheat the food properly if their reminder is just right where they are instead of being in a different place. So the picture here on this slide is actually the magnet that we created. So we're going to get those created and then distribute those to restaurants. And then the third priority area is sanitizer buckets. So for this intervention strategy, we decided similarly to do a social marketing campaign. For this specific area, we're using posters, and we made the posters kind of with a certain audience in mind of restaurant staff. So we created them to really try to be like relevant and to use humor to make staff remember about the importance of creating and maintaining a sanitizer bucket. So with all of these priority area interventions, the sanitarians from the health department will actually be giving all of the information out to food establishments, probably beginning in 2024, but they'll give kind of a summary of the risk report and then materials. So the posters, the magnets, and then some template cold holding logs with instructions. And then this slide is just pictures of all of the posters that I created for this campaign. So as you can see, we tried to like be kind of funny so that they were more memorable and something that the staff would potentially actually look at. Okay, so the next steps for this project is that the Flathead City County Health Department environmental health staff will begin educating restaurants on the upcoming changes. So they decided that the incentive points will be available for the use of cold holding logs beginning in January of 2024. So starting kind of right now and moving forward, they're going to make sure that all of the restaurants and food establishments have information about what's coming and have access to those cold holding log templates and the instructions and specifications. And then after 60 months, according to the FDA program standards, the risk study will have to be completed again. So they'll pull all of that data again in 60 months, and they'll analyze that to determine if the selected interventions that we used were able to make a difference on the prevalence of the associated risk factors. So hopefully in 60 months, we'll see that cold holding, reheating, and sanitizer buckets have fewer risk factor violations than they did to begin. All right, so that was my presentation. Hopefully I'm under 10 minutes. And I just want to say thank you to the Flathead City County Health Department and especially to Jim Wardensky for helping me with this project. It was really great to get to work in environmental health. It's kind of a field of public health that I'm not super familiar with. So I got to learn a bunch of new things and really kind of dive into what foodborne illness risk factors look like. So that was really interesting. And I will be available for questions at the end of all the presentations.
Thanks, Malia. That was great. Yeah.